Hello everyone, today I'm here to explore this PowerPoint on schizophrenia made by Tiani, Olivia and Sarah. Let's start with what is schizophrenia. Schizophrenia is a complex mental disorder which can be characterized by perceptive, cognitive, emotional and behavioral disturbances. It affects approximately 24 million people worldwide and is accompanied by positive, negative and cognitive symptoms. Positive symptoms refers to an individual experiencing behaviors that are outside the norm, such as vivid visual, auditory, and other sensory hallucinations and delusions. These often feature themes of punishment, death, jealousy, and paranoia. It can be hard for patients to challenge, especially when hearing voices. This can be very frightening and stressful. These symptoms are not always present, but alert family and health professionals to an active period of schizophrenia. Negative symptoms are experienced more consistently and are harder to identify. Symptoms include social withdrawal, isolation from family, friends, work, and activity. They may find it very difficult to engage, which is shown through lack of eye contact, restrictive affect, fixed expression. Individuals may also find loss of interest in relationships, hobbies, and daily activities. Cognitive symptoms are similar to negative symptoms. They occur frequently, but they are hard to identify and treat. Symptoms include difficulty expressing and feeling emotion, memory impairments, disorganized thoughts, difficulty concentrating, processing, planning, fulfilling tasks, and abstract thinking. The clinical reasoning cycle is important to use as it helps health professionals understand and help management and treatment of the individual with schizophrenia. The things that are important to consider is patient information, such as age and gender, physical and emotional state, collecting relevant cues and information, processing of information, identifying issues and problems, as well as establishing both short-term and long-term goals, taking action, evaluating outcomes, and reflecting on process. The etiology of schizophrenia is still unknown. There is ongoing research to identify new plausible themes which research continues to support. Key ideas include biochemical factors, genetics, prenatal factors, and stresses as potential causes. The pathophysiology is also widely unknown, but theories are continued to be researched. Neurotransmitter theories have persistently been supported by evidence, findings, and pharmacology. There is particular research pointing to dysfunction of presynaptic dopamine as being a direct link to psychosis. Schizophrenia has a large impact on the individual, their family, and the community. Schizophrenia can challenge individuals' daily life. It can have a large impact on their personal life, work, social, and academic skills, as well as their leisure activities. Early diagnosis is key, as late treatment can increase the severity of the illness. Symptoms can have severe impacts on their physical, emotional, and social well-being. Schizophrenia has a substantial impact on the family members, individually and as a unit. They often feel burden, guilt, shame, and anxiety due to social, emotional, and financial impact. Caregivers often worry about the care of their loved ones once they no longer can. It is important that they have sufficient resources to support them through their journey. Often, patients can feel social disconnection from the community when trying to resettle back into the community. Therefore, they require extensive support to ensure a smooth transition from inpatient care to outpatient care. Individuals with schizophrenia have a higher risk of developing cardiovascular disease, diabetes, and cancer, resulting in a much shorter life expectancy. The economical demand for individuals is high due to the care, treatment, prevention, and support provided for individuals as well as their families with schizophrenia. While there is no cure for schizophrenia, it can be managed and treated to reduce relapse and symptoms from occurring. Assessments used to diagnose schizophrenia include the DSM-5, the mental state exam, psychiatric evaluation, MRI, and CT. Treatments include medication, CBT, DBT, and ECT. Nursing interventions which are important when looking after patients with schizophrenia and their families is education. Education on both medications and schizophrenia. Therapy and promoting therapy for their individual and their family is a very important thing, especially with social skills training, and also addressing emotions and comorbidities associated with schizophrenia. Concluding this PowerPoint, schizophrenia is a complex long-term mental illness. The etiology and pathophysiology of schizophrenia remains relatively unknown, whilst there are many theories. Assessments include MSE, DSM, psychiatric evaluation, and physical assessment. Treatments can include medications such as CBT and DBT and ECT. Nursing interventions include medication management, therapy sessions, and education. Schizophrenia can be life-altering. Social, emotional, and financial impact on the family is a very, very strong risk. Individuals require financial and ongoing support resources from the community. Thank you very much for watching our PowerPoint on schizophrenia.